Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy-Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. Hi, Heidi. Thank you so much for being with me here today. Would you like to start by introducing yourself?
I'd love to. Thank you so much. My name is Heidi Berthoud, pronounced like two bears. My pronouns are she, her, and my background is public health. So I have a master's degree in public health from the University of Washington. I'm based in Seattle, Washington, and I've worked in a range of different activities, everything from government work to nonprofits. And I've also been invited to work with indigenous communities here locally in Washington State and the region. So a real wide range of experiences.
Great, fantastic. And what's the name of your consultancy and I guess the types of clients that you sort of work with through that consultancy?
Thank you for asking. Yes, so my consultancy is Heidi Berthoud Consulting. And I also have an interest in focus area in reproductive health, which I didn't mention earlier, but my clients are largely nonprofit health and social service organizations. And I also work with a lot of local public health departments here in the Pacific Northwest region. So a whole mix of types of data collection. I do program evaluation and I do what are called community health needs assessments here in the US, which are really important snapshots into a community's health, into what the community thinks are the main issues, and highlighting issues and data for policymakers and grant makers to use to support programs.
Really good. Well, I know that you, as a consultant, you might find yourself doing a range of things. Consulting is quite broad, particularly within public health. It covers a range of different types of issues. I'd really want to understand what problem you would say, in particular, that you're trying to solve through your consultancy.
I, as the owner and founder of my consultancy, am really passionate about making data accessible and making information accessible. So, drawing on the traditions of some of the indigenous folks I've worked with, data sovereignty is a really important topic here. And that's essentially the idea of gathering data from communities, but then giving it back to those communities. So, when we go in and we talk to people, we gather all kinds of different types of data, understanding how to return that data to them, how to return it to them in a way that's meaningful, that respects their community, and also collecting data for evaluations in a way that's maybe a little bit more culturally responsive. So one of my clients right now is a Somali refugee organization, and one of their grant funders really wants them to do a lot of surveys, but they actually enjoy sharing data more in kind of a talking circle situation, or maybe one-on-one. And so just trying to get creative about how we collect data about our communities and then how we share that back with them.
I'm so glad that you shared that in that way, because I'm reminded why I reached out and said, Heidi, can you please be on the mini series? Because there's something about the communities that you're working with and the way in which you're working and the way that you articulate how you're working with those communities that I really want to drive home in this Global Health Equity mini series. Because that little bit about, sort of giving that data back to communities, I think that's where a lot of sort of organizations, a lot of sort of initiatives fall down, because we think that that data now belongs to us because we've paid, we've incentivized people, we've given them, I don't know, vouchers, or we've provided food at the consultation, and we think, see, look, I've paid you off. But actually the most valuable thing is that data. So I just wanted to spend a little bit of time just reiterating that, so that that point was not missed. So today I was sort of brought you on to talk about effectiveness in particular, because that's one of the 8 public health principles that I really want to draw attention to through this series. And my question to you really is, what do you think sparks your interest in the word effectiveness? Sort of what comes to mind, and of course, how are you working to address this through your own consultancy?
Well, I love how you highlighted the data piece, and I think that's exactly how effectiveness plays out in my work and in my experience. If we collect data and can't share it with communities or with decision makers in a way that effectively uh, portrays the message, shows what's happening in that community, provides a really actionable and tangible way for people to decide and understand what's happening, then we're not really doing our job, in my opinion. And so I think effectiveness for me is exactly the outcome I'm looking for when I launch a project in a community. I want I want them, for example, if they highlight the need for mental health services, which we're seeing all across the country, and I think globally right now, I want there to be some really actionable steps that can be taken. And I want the outcome to be some changes starting to happen in that community because of the data we've collected. And so I think the effectiveness of our work and our projects and what we're doing in communities should be evident in the outcomes that we're seeing. So I hope that was a little long-winded, but I think that that's really in the end, that's the goal that we're looking for, is to have that, at least in my consultancy for sure, is to have that approach and that report be something that can be used to actually improve health outcomes long term.
No, the extra detail absolutely clarifies, sort of what you said earlier on a little bit more in a brief way, which was that actually data is really great, but it's even better in the hands of the people who it belongs to, and it's even better if once it's in those hands, they understand what to do with that information. And so that's the community, but also the organizations who initiated projects or sort of seeking to understand something. They too, once that data lands in their hands, also have an understanding of what that data is telling them, so that they know how to make effective change, at whatever level is required. So I'm really curious as to, just going back to effectiveness again, how you think we can make work around effectiveness more intersectional.
I love that. I think, and this is going to be a little bit of my call to action too, but I think listening. So I think the intersectionality piece comes when you understand what a community needs. So before we go in and collect that data, understanding how a community's maybe traumatic past, how a community's space and place, how they've been perceived in their larger community. All of those things play into how we want to think about the data we're collecting and how we organize it and report on it. And so for me, the intersectionality piece really comes down to listening to those communities. So like when I've been invited to work in an indigenous community, there's a lot of trust that needs to be built there, and spending the time to build the trust is a really important step. Sometimes that means timelines are different. Timelines get delayed, but for me, that's a really important piece. Or being able to adjust something to maybe collect data in multiple languages so that you can reflect that back to that community in their own language. These are just some examples of things that I'm thinking about in my exact work that I'm doing. But I think the biggest way to approach intersectionality is to really listen to the other person, to the other individual, to the whole community that's maybe inviting you in to do work with them.
Mm-hmm. And even in public health academia, we sort of talk about finding the meaning from the data that's collected. So it's more in qualitative data collection, but we're looking at what someone has written or what someone has said or what someone has even sketched. We talk about photo elicitation. What does it mean though? What are we looking to find out about what that person is saying? And when we're thinking intersectionally, we're actually doing just that. We're thinking about the deeper meaning. We're thinking about the cultural implications. We're thinking about sort of taking that trauma-informed approach that factors in things like psychological safety. What is going to work for that individual, those individuals, or that group of people. So you're hitting the nail on the head in your responses here. And I guess just linking into that call to action again around listening. How can we listen then? It's one thing to say, here's a call to action, but what does listening look like in practice?
Yeah, I appreciate that. And I love that you brought up trauma informed, because I think that's a big part of listening, is also educating ourselves on different types and ways to listen and to respond to communities. And how does that look? I mean, I think that's different for everyone. It's different for how we present to the world. So I'm a white woman. I need to think about what that means and what that looks like when I walk into a community. Maybe I'm not the best person to walk into that community. Maybe I'm not the representative that that community needs. And so listening is also, it's an act of actually listening to the other individual, but listening to the collective community. What's the message you're hearing? What are you reading maybe in literature or current writings about that community. You know, there's like the queer community here in the US has tons and tons of advocacy platforms and things out there. I think educate yourself on what those communities are saying, not just what someone's actually speaking to you, but sort of that larger listening concept. I think for me is really important, that self-education piece. And we won't always get it right. And I think also just trying to have some grace and space for each other and ask questions and try to be as present as possible.
Absolutely, absolutely. So, I would even reflect on that and say that listening looks like, also communicating back. Sometimes it means like, so is it correct that you were saying? Is it just to double check from my understanding in case I'm confused? Could you just clarify for me? And that doesn't have to be a conversation. It can be a clarification document. I can imagine I've seen that. It can be a consultation. It can be getting people around the table rather than just on the menu. That's sort of an analogy that we use. Being around the table, not just on the menu. A point of discussion. I promise I'd keep this conversation really short because I don't want people to get bored or tired of focusing too much on any one of these principles. It's just a taster session, really. But I would love to know if people want to get in contact with you, what's the best way that they can contact you and learn more about your business, learn more about how you're practicing public health, who you're serving, and just follow your work, essentially.
Thank you. I appreciate that. So I'm on LinkedIn the most as my social media platform for my business. So you can find me personally at Heidi Berthoud on LinkedIn, and that's Berthoud, lots of silent letters, or my consulting business, which is Heidi Berthoud Consulting. My email is also Heidi at Berthoud Consulting, so Berthoud. And I would love to connect. And I'm also in the process of getting ready to launch some more examples of work that I'm doing on LinkedIn. So look for those. I've been working with some visual designers to really make reporting beautiful and accessible and usable. So I'll be launching a lot of that on LinkedIn over the next several months and through the rest of this year.
Amazing. So, I mean, we love data, but we even love data when it's presented nicely. So I'm looking forward to seeing what you end up doing with that. So I just want to thank you for sort of making this time. I know you're at the start of your day. I'm at the end of my day. So I hope this was a great start to your day. And I thank you for your time and for your insight and wisdom.
Absolutely. Thank you. Bye.